there's a combination, I believe, of both of the food that we put in our mouths and the light that we let in our eyes is
Hmm.
also extremely important, because when we think about ancestrally, naturally, as human animals on earth, what would we eat, right? And so we would kill the big mammoth woolly beast and eat our fatty meat, right? But what would we have on our skin and in our eyes? Sunlight, moonlight, firelight, and candlelight. All of this other artificial, which I like, equivalent to junk food, is junk light, and it actually does damage to both our eyes are connected to our brain.
Mm.
And it's not our I as an eye doctor, I was like, oh, our eyes are for vision.
Welcome to the Protecting Your Nest podcast. Today I'm thrilled to introduce a true trailblazer in my eyes and also a fellow carnivore doctor, Dr. Lisa Wiedeman. Dr. Wiedeman is not only a practicing ophthalmologist with decades of experience, but she's also passionate about advocating for the carnivore diet, which she's followed for 15, is it 15 or 16 years
I
now?
am a couple weeks short of 16 years.
Crazy. Her personal health journey has inspired countless individuals to rethink their diets and consider the profound impact of nutrition and overall health and chronic disease, and of course, including conditions of the eye. In today's discussion, we'll delve into the connection between diabetes and eye conditions, the role of low carb and carnivore diets in protecting our vision, and reflections on the recent Chicago meetup which is where I met her because we were both speakers at this Chicago meetup. So thanks, Doc, for carving out a little time as you are out here, as I am, trying to get this message out. So thanks for coming to the podcast.
Yeah, thank you so much, Tony, for having me, because this is my passion, is to help people understand all of the misinformation that's out there with the plant-based push and the wrong messages that are out there surrounding fatty red meat, and how life-changing this can be for our health, both mentally and physically. And I start with how it really changed my life, because I had such a disordered relationship with food and a sugar and carb and processed food addiction, that it really brought me out of that misery.
Yeah, well, who wants to live in misery? And I know from my belly, which improved as I used this diet to improve my symptoms of irritable bowel. I just thought it was normal, and I normalized that this was going to be my destiny. And when you find hope and you improve things, and then you have a wife who's struggling with type 1 diabetes, and all of a sudden she can get her blood sugars to be stable by simply changing what you put on your fork, it's hard to not want to yell it from the rooftop. So that's why I appreciate you being in this space. And what's really interesting, as we learned, as you just shared, 16 years as a carnivore. So, uh, what led you to such an extreme diet, and what changes have you experienced since doing it?
Yeah, so my path in this really started long ago, before I even realized it and knew it. Pretty much, I think a lot of times from our childhood, we start developing um, relationships with food that are not related to just hunger and satiety. We're rewarded with food. We look forward to dessert. I liked hopping on my bike and riding to the five and dime store to get candy with my friends, and going out for ice cream, and then I got an easy bake oven for my birthday, and realized that this was, just as time went on. And I didn't realize it, but I had put on weight. I was a chubby kid. We had, ice cream in the house and desserts in the house, but nothing really much out of the ordinary as far as, that goes. But as time went on, I realized looking back now, I really did turn to food for the wrong reasons. I think a lot of times we try to fill an emotional void, or we eat reactively to those addictive foods to sort of numb ourselves. Um, and it worsened and worsened. It became secretive behavior. It became very disordered behavior, to a full blown eating disorder. And I just could not figure it out. I'm, an intelligent woman now going through grad school and still doing this. And it was, I didn't talk about it to anybody because it's humiliating and it's embarrassing. And so as I, continued on my search, fortunately, the internet came about and I could do a lot of surfing. And I came across a group called Zeroing In on Health. And this amazing gentleman, Charles Washington, had branched off of a low carb group. And these people in there were talking intelligent discussions about Villamar Stephenson, Fat of the Land, Not by Bread Alone. These are like old writings of explorers, basically eating a fully animal diet. And I said, and then fortunately, there was a couple women in there because people kind of journaled and you could read each other's journals. And there was a couple women who had resolved their disordered eating with this.
Hmm.
And I was like, wow, this is crazy. These people are just eating meat and drinking water. This is a little wacky. I
Right.
don't know. And of course, I grew up in the whole generation of low fat, and oh, you eat margarine instead of butter, and all of that horribly toxic information that came about. And yeah, I was eating chicken breast salads and rice cakes and cabbage soup diets, and you name it. I tried it and did it, and nothing worked. Had still been faltering back into what I call the carb ditch and into the binges. And so when I came across this group, I was at a level where, I say, Tony, it's interesting for somebody to actually wrap their brain around this and take to it. You have to have that why that makes you cry. You have to have a motivating issue that makes you think, maybe there is something to this. Ancestrally, I think we were intended to be animals on earth and hunt and eat fatty meat, not, forage for some potatoes and eat some kale. And so as I kept thinking that evening when I found it, March 9th, 2009, I said, well, what the heck? Let me jump in and do it. I'll be my own N=1 experiment. Let me see. I will research along the way and just try to figure this whole thing out. And lo and behold, I just felt better and better. And I was relieved of cravings. And I was reading amongst the others in there. They were resolving themselves of
Hmm.
bipolar disorder, depression, diabetes, skin issues, gut issues, Crohn's disease, IBS, arthritis. And I was like, wow, okay, well, I think we're onto something here, folks. This is still way before YouTube and Instagram and
Right.
Facebook. So I felt like I just wanted to shout it from the rooftop. I wanted people to understand and know what's out here and what, we're doing here. And nobody really wants to listen to somebody talk about not eating fruits and vegetables, not eating any fiber, eating lots of fatty red meat. Everybody's concerned you're going to die, you're going to kill yourself. It's all great. You think it's great, but you're going to have a heart attack. And so I got pretty quiet and just did my thing for quite a while. And then, when this became more prominent with Sean Baker, Dr. Sean Baker, the orthopedic surgeon, going on Joe Rogan, and then Michaela Peterson and Jordan Peterson telling their stories about this. And it just kept going and going. And I would read some comments in there that people would say, well, Dr. Baker, that's all fine, but it's not sustainable and
Hmm.
it's not healthy long term. So I felt obligated to raise my hand at this point and made myself a little Instagram account so I could go in there and comment and say, well, I mean, at the time, this was probably, I don't know, 4 or 5 years ago. I said, well, I've been doing this for 12 years now and I'm in perfectly good health and I can do cartwheels on the beach. And so it grew from there. So just amazingly that this, I call it the grassroots effort
Yeah,
is just coming out and people all over are talking about the benefits that they're gaining from this. And a lot of medical professionals. So, I felt, I'm going to say obligated. I was passionate to be a representative of
mhm,
the medical field and say, you know what, we've been fed a lot of hogwash about statins and about eggs and cholesterol and red meat. And I was just anxious to, do whatever I could to get as many people healthy as I could.
yeah, and I hope for the doctors or other clinicians who hear our voice that if you're already aware that this diet heals, please know that the American Diabetes Association, it has said low carb is okay. At least that the Society for Clinical Endocrinology has said it's okay. The American Heart Association has put low carb and keto as dietary options. So if you're concerned about your license, there's organizations that have endorsed it, and you need to just lean on that. If you have seen benefit, and if you haven't seen benefit and you haven't done the experiment, please do the experiment. If you're suffering from, I did a video talking about the 50 plus medical conditions that benefit from diets where you reduce the carbs, like keto, for example, and carnivore is a keto diet. And there's a rare person who's dealing with an illness that doesn't fit one of those 50. So if you are suffering, or if you're a nutrition professional and you're saying, I'm still overweight, why is this? Or I'm still struggling with diabetes. Why can't I control my blood sugars or reverse type 2 diabetes? Well, there's an answer. And you owe it to yourself and to your patients to do this so that they will then have an option to do something that actually we know works. And I want to say this. I'm a family doctor, you're an eye doctor, ophthalmologist. So I see the entire spectrum of patients as you do. And I find that some thrive on keto, some thrive on low carb, and some thrive on carnivore. So when you're thinking about the people that are in front of you, who should, if somebody's watching this and they're like, why Dr. Hampton keeps talking about carnivore? Well, there are certain people who really need to go there to heal. So what types of patients do you think need to consider carnivore versus any other dietary pattern?
Well, I have diabetics who will sit in my chair, and let's just say, well, both type 1 and type 2 can greatly benefit from this, but there's just such an explosion of type 2 diabetics, and I will diagnose diabetic retinopathy, and I will explain to them that this is totally reversible, and you have some bleeding in your eye that can lead to blindness. And Tony, I'm just shocked that well, I'm not shocked. There's, everybody has a different mindset with this. Some are like, what do you mean it's reversible? Tell me more. I got to learn. I want to do whatever you have to say. And I will say, look, your body does not tolerate carbs anymore,
Right.
and we need to eliminate them. And we need to get them as low as possible to try to demedicate you and get you off medication and stabilize and normalize your blood sugar. And all right, what do I got to do? And I go, well, no pasta, no bread, no rice, no sugar, right? And they go, oh, doc, I'm Italian. I can't do that. And I'm like, "All right, I'll see you in 6 months and we'll check how the bleeding progresses." So, when and then so I walk very cautiously in the question of which diet for what person, because some people, I mean, I was willing and able and ready at my stage of the journey to jump in and do, meat and water. And at that point, I feel like I would eat mud if you told me it was going to cure me of my misery. I had lived for 30 years. And so, for some, it's better to do it stepwise. Start by eliminating the starchy carbs, and then, diabetics have no permission to eat fruit. Fruit is sugar, and everybody's, oh, but fruit's healthy. And I was like, yeah, no, not for you. Remember, I said you don't tolerate that. And yeah, so I would love to tell everybody, do a 90-day carnivore trial and see what you learn from it. It's a blip in the radar in your life,
It is.
and the amazing information you can gain from it is so worthwhile. And that's what I like to lean toward. But then I also realize it is such an extreme change from what we are habitually and routinely used to eating. Our and where socialization is surrounds food, our traditions, our holidays, our family time, our friends, and it becomes a very it can become a very difficult thing to implement at the beginning unless you surround yourself with other people who are striving for optimal health themselves.
That's right. Well, I'm going to ask you to talk a little bit about some eye related things. But before I do that, I want to say to everybody checking out this episode, you know, we get it. Like there are so many belief systems that we have, they're ingrained in us. And when someone questions that, just like your doctor, they have belief systems that have scared them away from keto. One of my newer videos coming out are going to be the 5 myths that doctors still believe about keto. It's going to harm my kidneys. It's going to increase my risk for heart disease. It's going to, all of these things that people still believe they're outdated. Saturated fat's going to harm my patients. So some of it is fearing things you shouldn't fear. Some of it is you're not ready. Many of us in healthcare learned about, uh, you know, uh, are people ready for change? We learned about motivational interviewing. So we had to learn that people have to be ready. And if they're not ready, we're told not to, just as Lisa has suggested, don't push back. We say, I'll see you in a few months and see how much damage has occurred. We're trained to meet people where they are. But we know there's a lot of things about the mindset and rather you are valuing what we're saying. And so we get it, but what we won't do is sit back and allow you to not know the things that can heal you. And it would be on the verge of malpractice to know this and to see stories of healing and not share that, which is why we're doing that today. I just want to see it being done as I suggested at the meetup we'll talk about uh, in Chicago. Uh, I'm in a health system. I'm trying to, influence them to focus on healing in a way that will keep people out of the hospital. So that's really important. But let's talk about some people see your name, your face on the thumbnail, and they say she's going to talk about the eye. So at least do a little bit of that, since that's the world you live in. And many people aren't aware of this connection between diabetes and eye diseases like retinopathy and cataract and macular edema. So, can you, in particular, those three, retinopathy, cataract, and macular edema, if you could just kind of explain these conditions a little bit and why diabetes can actually be the root cause of some of these things?
Yeah, so one of the things that I have really figured out through practicing and seeing patients and this dietary change is, the our bodies are intended to evolve and
Mhm.
heal and be healthy. They really truly are. You get cut, you scab, and you heal. You get a virus, your body spikes a fever to kill the virus off, right? All of these mechanisms is our bodies are here to evolve and lead themselves to health, right? To stay on earth. And we have to get out of the way because we live in such a toxic environment. And so in getting to the I question, I say when you correct the diet, you remove the junk food, and you put in nutrient dense food, your body is going to try to heal every organ system, the skin, the joints, the eyes, the gut, right? It's everything. So, so yes, absolutely. I have some specific patients who I can tell you who I was willing to go and step on eggshells away from standard of care and guide these patients and remarkable healing. And this is root cause healing. This is no longer about writing a prescription and sending the patient to the pharmacy. Why are your eyes dry?
Right.
Why do you have macular degeneration, right? Why are your eyes developing diabetic retinopathy? What is the root cause? There's nothing at that point unless I'm a physician who is thinking that way. There's nothing that's going to there's no magic pill. There's nothing that's going to halt and prevent the progression or reverse these things. It's just the pharmaceutical companies are not they're in business to make money, not to heal and reverse your disease.
That's right.
They're there to mask the symptoms. And so, you know, um, with things like, so obviously the dietary change for diabetes to prevent diabetic retinopathy is very clear. And then when you go into macular degeneration, Dr. Chris Kenobi is an ophthalmologist that actually left practice and spent 8 years researching and putting the connection together with the processed food and seed oils and macular degeneration, because it used to be very, very rare in 1910, and now it's so common and so prominent, it's scary. And so there's a combination, I believe, of both of the food that we put in our mouths and the light that we let in our eyes is
Hmm.
also extremely important, because when we think about ancestrally, naturally, as human animals on earth, what would we eat, right? And so we would kill the big mammoth woolly beast and eat our fatty meat, right? But what would we have on our skin and in our eyes? Sunlight, moonlight, firelight, and candlelight. All of this other artificial, which I like, equivalent to junk food, is junk light, and it actually does damage to both our eyes are connected to our brain.
Mm.
And it's not as an eye doctor, I was like, oh, our eyes are for vision. Let's learn all the intricacies of how our eyes provide vision. Well, guess what? There are so many different receptors in our eyes that are not related to actual vision, but related to sending signals to the pineal gland, the SCN, the suprachiasmatic nucleus.
Hmm.
And it is critically important that we get these messages from the natural sunlight. And when we are in an environment of artificial light, the fluorescent light in offices, the recess lights, the computer screens, the TV screens, the phone screens, the laptops, that light does not belong in our eyes. And so I think as far as cataracts, macular degeneration, and we'll go into everything, dry eye, it's part of an autoimmune issue. All of that is I'm going to say very closely tied to both equally the food and the light environment that we now live in.
Yeah, and it's so important um, that the person who's listening to us understand, particularly if you have diabetes, which is easily one of the worst things that you'll deal with if you don't adapt your diet so that you don't have it anymore for type 2. And for type 1s, like my wife, um, if you want to normalize your A1C, you have to change your diet. You will never, ever, ever have control of your blood sugars if you eat a diet where you're chasing spikes. So those blood sugar spikes are so critical in harming our entire body. If you could speak a little bit about what happens to your blood vessels in your eyes that then cause harm. happening that the average person needs to understand. So that I just had a, let me say this real quick. I had a patient, and I shared this previously, but he'll be 90 in a couple of weeks. A1C was 9 when I met him. And he was so casual about it with his daughter as he shared. It may have been his wife, but he was so casual. And he said, what's going, how, I think she asked, how are the labs? And I looked at, it was 4 months later, and all I did is give him a 2-page handout that was low carb. I said, just eat what's on this paper and don't eat what it tells you not to eat. The A1C at 9 is a 212 blood sugar. What kind of damage is that doing? The A1C at the next visit was 4.6.
Wow.
And it's like, he just made this change. And I said, what did you do? I always ask patients dramatically, what did you do? He said, I followed the freaking paper. And then he told the story about how he had multiple family members who died from complications of diabetes. So as you share with my audience why they should hear this message, what's happening when you have a high blood sugar that can then lead to vision loss or blindness? What makes that happen?
Yeah, so the easiest and simplest way to explain it is diabetes is actually a disease of small blood vessels, like capillaries, okay? And so you can understand, people get peripheral neuropathy. They get numbness in their feet. Sometimes they actually lose toes because of that. And our eyes are so rich with blood vessels because it's a highly metabolic organ, and full of capillaries. And when these capillaries get damaged and they leak, and especially so in the eye, when you get macular edema, and you can get diabetic macular edema, there's fluid leaking from these blood vessels that causes damage to the retina, the macula and the retina. So it's just really important to understand that, it's hard to comprehend that this is, for most people, you microscopic, right? We're not actually seeing what's happening in our toes or our feet. But it's important to understand that systemically, having out of control blood sugar is a definite cause of inflammation and degeneration. And to and that's why I think the CGMs are very beneficial, to actually let people, they can visualize what their blood sugar is and know what their blood sugar should be, and then see the ramifications of eating a certain food item, and then relate that to yourself as, gosh, look at that spike in that blood sugar that just happened. That's damaging to my capillaries. That's damaging to my body. And we could go further than just, the eyes. Then it's, your brain, depression, anxiety, it's inflammation. And it's really important that people, I know it, it's very hard, like I said before, to wrap our brain around this. We'll call it, it seems to many as an extreme um, way of eating, but I'll tell you, this seems so normal to me after 16 years. I am so embracing still eating meat, seafood, and eggs. Okay. And
Mhm.
there's so much variety. People say, don't you get boring? Isn't that so boring? I could never do that. I say, no, you know what's boring? Boring is waiting online at the pharmacy for a prescription. Boring is waiting in the waiting room of a doctor's office. That's boring. And I don't ever have to do that boring thing. I get to
Yeah,
eat ribeye and ribs and flanken ribs and oxtail, and I could go on and on. I get excited when I'm hungry. Anything like that tastes fabulous, and it's not boring because our health just does not um, give a darn about anybody else's opinion or your excuses. You have to really learn, understand, educate yourself that this is the proper human diet. This is optimal. This is the most nutrient dense way to eat. And I'm so enthusiastic to as I practice still um, uh, on a limited basis, because I've actually, I do much more in trying to spread the word. I feel like I can do so much more benefit to so many more people doing what I'm doing now. But just for everybody to understand that this is healing, not just your vision and your eyes, but every organ system in your body.
Yeah, because we have arteries everywhere. We have nerves, which are also impacted everywhere. And um, I think people are hearing so many mixed messages out there that they don't know what to believe. And I just want to be clear that, you know, I'll be honest, when I got my master's in nutrition, it was mostly about reviewing biochemistry. It was less about following the advice of my professors, because many of them are still plant-based because they still had this old ideology. You can do keto for a little bit. We know, we can see that it's the best diet for weight loss and diabetes, but, but, and it was always this but, that too much protein, which is not what a keto diet is, and it's not a high protein diet anyway, it's a high fat diet, but too much of this is bad for your kidneys. What about the saturated fat? What about, uh, how dare they still worry about ketoacidosis? I mean, the stuff you hear, and how dare they not take the time to celebrate when a doctor like you or me puts in front of them a patient whose retinopathy improves and their macular edema improves, and not be completely curious about that and say, what did you do? I've been a doctor for 20 years or 30 years or whatever, and I've not seen that ever happen. They should be at the front of they should be lined up at our clinics asking us, what are you doing? And I said, man, I gave this almost 90-year-old a piece of paper that said, don't eat that garbage, processed foods, seed oils, refined, all these sugars. And that's all they did, and things got better. And if that's true, at the minimum, that doctor should then say, I need to do an experiment to see if I can do that for my patients. And that's why I think your advocacy is so important. And I'm happy that you're finding the time and you're carving out your schedule in such a way that gives you time to spend time with me. The night before this recording, you were doing a live stream with Kerry of HomesteadHow, with Bella the Steak and Butter Gal, and Dr. Kiltz and others. I am excited for that. Um, if you were to keep things simple and you said, okay, I have this condition, and I hear diet is important. What would you say to a person who's never even heard about low carb, keto, or carnivore in terms of why those diets make the most sense compared to other diets which are being advocated out there?
Yeah, well, I'm going to say, well, yeah, I have so many people that will say, no, but I was told vegetarian is the way to go.
Of
That's
course.
what's healthy. And that's what I saw. This person told me how much better they got. And, there's cognitive dissonance. And so I, you know, I I fought through the cognitive dissonance because of wanting to trust that all of these people who were talking about how much their lives were changed, I said, I'm going to study this. I'm going to figure this out. And then I started understanding that vegetables, plants, also want to evolve and stay on Earth, and they do so by a protective mechanism of pretty much chemical warfare. They have oxalates, phytates, lectins, and so I just kept logically trying to figure out what diet, what, are we herbivores? Are we omnivores? Are we carnivores? And, Tony, I'm not here to be dogmatic and say everybody's got to be carnivore, because that doesn't serve this mission to like pinhole this into any sort of cult like thing that people are starting to label this. But, I have to say, I think there's so many people so excited about this, and so many people that want to reach out to other people to get them to understand. And like you said, and I said, I just wanted to scream it from the rooftops. But I, I don't put on my television at all. But for people that do, they see people like Dr. Oz. They see the mainstream media talk to them all about, I cringe. I get mailings, junk mail come in, and I look at them from hospital systems that are touting the healthy oils to eat, our vegetable oils. And, I just think a sick population are customers. And I hate to say it, that follow the money and it comes down to money, but it really does truly. I've been in this for 16 years now, and I get angry and mad at the fact that there are many physicians, like you said, that are not lining up eager to hear our story of healing our patients. I mean, I've had patients, this woman had significant autoimmune issue, and she had bilateral uveitis, which is an inflammation of the eyes, which indicates systemic cause. And she was at her wits' end. She said, I'm even starting to do juicing now. I don't know what to do. And I go, ah, let me talk to you here a little bit. I know this sounds crazy, but, and I gave her a little, 5-minute ditty
Mhm.
about this. And she came back with tears in her eyes a month later, feeling so significantly better. Not just her eye inflammation improved, but she went to her rheumatologist. She goes, and she was only in her early 40s. She had pain walking up and down steps. She could barely bend over. She was in a significant situation. And
Mm.
I would have expected a call from this guy, because she was, of course, telling him what she's doing. Nothing, no interaction
Mm.
whatsoever. Painful to me.
I I can't. I still don't believe that when it happens. It's my nephrologist. They'll see the uh, blood urea nitrogen and creatinine improve, the microalbumin improve. Nothing. Um, and I just don't understand it. Like, your job is to treat kidney disease, and you have people who are literally healing and reversing it. How could you not be curious? So it's going to continue to. So again, we are yelling from the rooftops, and that's what we're going to do. And I want to say this: um, if you're plant based, I was plant based for 8 years, and absolutely, compared to the standard American diet, my symptoms improved. My irritable bowel symptoms improved. Did they improve to the point where they are now? Absolutely not. I was still bloated, gassy, and I would still have flares. If I follow a carnivore diet and don't have moments of indulgence, my belly feels like $1,000,000. So it's understandable that anybody who uh, sees improvement, I would argue, you name a diet, you're going to improve if it's not the standard American diet. It's going to improve. But the reason for that is because you're eliminating processed foods in many of these diets. If you do a Mediterranean diet, you're eliminating processed food. Why don't I prefer a Mediterranean diet? Because those grains will spike your sugar. But you've reduced enough processed foods with a Mediterranean diet that you're going to do well. But if you're a diabetic, why would you eat quinoa, which is 40 carbs divided by 4, is 10 teaspoons of sugar? Why would you ever eat that if you have diabetes? And why would you lean on a diet that does not provide the essential amino acids and fatty acids like a animal-based diet? Why do vegans have to take B12? Because they can't get enough of that. Why do they have risks of anemia because they don't get a lot of iron out of their spinach. They only get 2% absorbed versus 40, 30, 40% with meat. And zinc and omega-3. It's hard to get the adequate omega-3 from the plant-based diet. So rather it's the anti-nutrients, the bioavailability of food that's much better with animal-based diets. Animal-based diets just make more sense. So I really want to encourage people, again, if you're still trying to heal, this is important that we understand these principles. Now, let's think beyond diet just for a moment. Outside of diet, if I were to walk into your, if I met you on the elevator, and somebody said to you, "Hey, doc, I'm doing diet pretty good. Are there any other things I need to think about to make sure I can see with these eyes that I have and be healthy with my eye health? Anything else?"
Yeah, the I call them the pillars of health, aside from obviously food being pretty close to the top of utmost importance. We have to pay attention to sleep, which ties into paying attention to circadian rhythm. And so I really am a big proponent of telling people you have to connect back with nature. Get your eyes out into the sunlight during sunrise time. The infrared rays at that particular angle is really important to signal to our bodies. And getting midday sun and getting some sunset sun. And when you're inside, avoiding ALAN, artificial lights at night.
Mm,
I don't put lights on in my house anymore. I have this very low amber lights when I need to. But I and then so the other thing is putting on these blue blocker glasses and
mm.
wearing these when we are in front of screens, because it is just like food can be toxic to our bodies, the wrong type of light can be. And so yeah, and I do feel like it has a very big impact on ocular health, both the food and the light. So I say keep junk food out of your mouth and keep junk light out of your eyes.
I love it. And yes, I do have, I look like, I always tell my wife I'm about to put on my glasses that make me look like a rapper. They look a little different than yours. So I
Yeah.
put them on, and I try to, and sometimes I'll forget. So we try to put it where I'll remember either, where we, right after dinner, or near the bed. So I'll kind of see it and give myself at least an hour at night. And certainly, like you said, you can kind of wear it when you're exposing yourself. These are, some people call it hacks. I have the Aura ring, on my finger, to give me data. And my wife's like, let me see what part of the day you were stressed and all these other things that these gadgets measure. But sometimes the data will help you then make better decisions. And you just want to optimize things, guys. I mean, if you are well rested, I'm sure your eyes will be a little happier. So we have to do these little things that will help us stay healthy. So let's think a little bit about our meet when we first met. We met at the Chicago meetup that Kerry of HomesteadHow arranged with Adam and others to connect some carnivores. Basically, me, you, and Dr. Kiltz were there, and some others. It was nice to. I had some patients who came through, who were there to kind of meet with like-minded folk. So it was really nice to have that event. And why do you think these types of gatherings are so powerful? I know there's another one coming up, I think in Florida. What's powerful about connecting with like-minded carnivores in the community?
Yeah, because we are not meant to live in isolation. As humans, we want to be connected, we want to love, and we want to be loved. And I'll say that when you turn to a very dramatically different way of eating than your friends, your family, and your coworkers, it feels a bit isolating. So I became passionate after I attended my first meetup back in 2009. It was a group of 20 of us from that forum that met at a restaurant in Philadelphia, and I'll never forget it because I was I was thinking to myself, oh my gosh, I am literally driving an hour and a half to go meet internet people. What am I doing? And by the, and I knew of who they were through the journaling and reading and communicating on the forum. But this is kind of crazy. Again, this is 16 years ago.
Yeah.
But within 60 seconds of getting there and just joining together with the discussions of our stories and our backgrounds and you know things that we've learned and what they've learned and sharing it was just magical. And I vowed when I came out of there I'm going to go to as many meetups as I can. And as of now I've either attended or hosted over 30 meetups. And I get so much out of when people come up to me and say, you don't know how much this has meant to me to be amongst these people. And then my goal, just like in the Chicago one, is that, local people, there's people who come from far and wide to them too, but a bunch of locals will then say, oh, let's exchange information. We can meet once a month.
That's right.
And you are who the five people you surround yourselves with, and you need to have people who like inspire you and can empower you to do better and be better, because this is really tough. I mean, this is a situation where we're in with our family and friends, and people are offering the cake and the cookies and the ice cream. What do you mean you're never going to have chocolate again? What are you doing? That's crazy. And you have all those kind of discussions, but it's just amazing being around other people who are just really interested in getting a lot of meat on their plate.
Yeah, that's right. And it is inspiring. And again, sometimes you need to hear inspiration from a clinician. Sometimes you need to hear it from someone who had a transformation, like Kerry of HomesteadHow. And sometimes you'll find you have a neighbor. Like when I was there was a group that said, "Oh, yeah, we actually meet twice a year already." And I was like, "Oh, okay." So like you said, we exchanged. And so next time they have one, I hope to be there. So I think that's really important. And I'm glad you got your blue light blocking glasses on, because you look a little bit like a superstar. It's matching your shirt.
Yeah.
And, really nice. And I say that because you will be a superstar soon, because you're going to be one of the doctors featured on the Healing Humanity documentary.
Yes.
Again, why we love Kerry so much, because he's taken his skills to help spread this word. So, um, when you think about I know they recently filmed you. When you think about the impact of this documentary, what comes to mind?
Wow. Yeah. What comes to mind is how life changing this has been for me, and how potentially reaching hopefully millions and millions of people, changing their lives in such a beneficial way. Because, Tony, without our health, we have nothing. We
That's
know that it's such a cliche, I guess, but when you really think about those words, without our health, we really have nothing. Without quality of life, where are we at? And so we really need to be doing everything that we can to just immerse ourselves in learning what misinformation we've been told all this time, how to fight the cognitive dissonance that bacon really is not unhealthy. And that, just to be able to impact other people to heal themselves and reverse the disease. That's my goal.
absolutely. Well, now that I've held you as a star, there were, the Lisa Kudos and the Lisa Bonets, Lisa Marie Presley. There's another Lisa that
Here I
the
am.
world would get to know, right? And
In your carnivore, Lisa.
that's right. You'll lead the Carnivore at Lisa group. So I'm really excited about that. A couple of misperceptions and myths, real quick. Your thoughts on this need to have fiber in the diet? People are still concerned about fiber, particularly. Just I would say as a general message, if you just talk to anybody walking down the street, they would say fiber is important. So what would you say to that person?
Well, fiber is just undigestible cellulose from plant matter. and it's not essential. It's never been an essential. It's not even a nutrient. I don't know what you call it. I call it abrasive to my colon because it's just going to go out because it's not digestible. And I can just well, there's a couple things. There's a great book called Fiber Menace. If
Mhm.
anybody wants to dig into more information about that, but yeah, I've not had a speck of fiber in 16 years, and I go to the bathroom just fine.
Well, thank God for that. And so I appreciate you sharing that. The other thing is more general. I've been probably coming up on 2 years now with Carnivore. You've been doing it. I'm a baby Carnivore. You're a little bit more experienced. So when you're facing people who are, thinking carnivore is a bad thing, what are the major? Give me an example of a myth that they really say, "Oh my God, that's gonna kill you because what?"
Yeah. Yeah, so I call them, Tony, I call them the naysayers.
Right, right,
I
right.
call them naysayers. I have actually an entire YouTube video called "Naysayers" and um, how to handle it because you know it's sad that some people will be so on the correct path with this and start this and feeling great and resolving issues and end up going back to their old ways because of being so confronted by loving family that are caring, and I understand that, they're not looking into the information. So all of their knowledge is coming from, fatty red meat's going to kill you. And so that's what they will come at. It does feel like a personal attack, and it does make me feel like I have to defend myself.
Mm,
And nobody likes to be in that position. So this is what I say. If somebody really is doing that, you're going to kill yourself. This what do you think is going to happen with all of that red meat and fat? And I say, thank you so much for your concern, but I've never felt better.
right,
And if you're really interested on finding out the truths behind the myths that you're spouting, I'd be happy to, send you some information.
that's
And
right.
and end it at that because you're not going to, number one, I say you can lead a horse to water, but you can't make him carnivore.
That's right. Right.
And people who are making these comments are, most of them are not truly interested in learning. They're more interested in convincing you that what you're doing is wrong. So I find over time I had to really pick and choose, where the conversation would go and how I would reply to it. But yeah, it's very, very difficult. But the funny thing is, out of this is, this person is so concerned about my beef and lamb diet, and meanwhile, they didn't say a word or didn't give a crap about the Rice Krispies and chocolate and ice cream and pizza and pasta and cookies I was eating. Not a single word happened then, but now all of a sudden I'm eating what is naturally on earth that I believe from all of my research. And there's a lot of, information to back me up. And people say, where's the study? Well, it's very hard to sequester a large group of carnivores and, the expense of it. And then who's out to make money? Again, follow the money. Who is supplying the grant money for that? And it's the pharmaceutical industry and the food industry and the healthcare industry are all out there making a lot of money off of keeping a population very sick. So, I think the biggest thing to understand is I say your health doesn't really need anybody else's approval and it doesn't care about anybody else's opinion. So, keep 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 going down your road of learning, understanding, and have your own experience with it, and then determine, where you go from there.
Yeah, I love all of that. And that's a nice way to kind of put a nice bow on this conversation. And I really appreciate you. And I think I'm just going to ask you the question I ask all my guests, which is how you hope to protect your nest over the next 12 months. And that acronym NEST, represents nutrition, focusing on exercise, less stress, more sleep, protecting our thoughts, maybe recovering from trauma. And then the rope that helps us get to the nest represents improving our relationships, avoiding things that harm us, like organisms and pollutants. And the E is for protecting our emotions and making sure our life experiences, like a meetup, serve us. So when you think about that acronym, you think about the next 12 months, are there areas that you plan to give extra attention to make sure Lisa's healthy?
Yeah. So yeah, this is such an interesting journey, and I call it it's really a journey to optimal health, and it 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 relies on picking up bits and pieces of information that you either act on or you push to the side. And there's certain ones, all of what you said, like the pillars of optimal health, like what you're saying is, decreasing stress, prioritizing your sleep. So one of the things, and I just really connected with this, and I I talk about with food, you can have green, yellow, and red circles. The green circles, as all systems go, it leads to health: meat, seafood, eggs, water, right? The yellow circle is those ones that are maybe a little questionable, that we might not have full sober behavior around. We have to have caution. Maybe I only eat it, um, like cheese is one of those because I can overdo it. I eat it when I'm at a restaurant on a burger because there's portion control. And then, of course, there's the red circle. That has to be those things that absolutely do not belong in my body. Well, we could translate that also to people in your lives. What people in the green circle nourish you, enrich you, um, and make you feel like you want to be a better person.
Mm,
Then there's the yellow circle people that sometimes you can't avoid them, but there's certain aspects of how they lead their life is not conducive to the way you want to lead yours. And then there's the red circle people where we really need to turn down some social invitations from
right.
those people, because maybe in the past all you did was drink it up with them or get nachos grande with them. And you have to understand that for trying to reach optimal health in all those different aspects that you talked about, you really have to guard yourself and try
Mm,
as best as you can to formulate what is ideal and optimal. Be selfish. We have our own one vessel we live in, and that's the most important thing, because without health, we can't really be loving, caring, and generous, and help anybody else.
well, I never saw people as red, yellow, and green until today.
But you kind of know what I mean,
I
right?
know exactly what you mean.
Yeah.
I will always keep that in mind. So for my listeners, the people in your life are either red, yellow, or green. So be mindful, and you can't be a victim. We have full control of who we expose ourselves to, who we spend time with, and there's ways to mitigate that. Even if you have people in your life you have to spend time with. I remember going to a family function, and somebody in that family was toxic. And all, but I had to go to the family function. So what I did is we were on the, it's a big house, so we were able to be on the side of the house where that person wasn't, cordial when we were faced with the person, and we mitigated it. So this does not have to be an all or nothing, but there's no reason to expose yourself to toxic people, and that'll help you continue being healthy, because that extra stress that maybe you would have had if you had have exposed yourself is affecting your metabolic health. So I really appreciate your framing. I think that's a nice message to kind of wrap up with. So in terms of how people can find Dr. Lisa, what's the best places? Social media. I know you got a YouTube channel. What would you say?
Yeah, so I post a bit of my day to day life on Instagram and YouTube. Yeah, I have some videos up there that I feel can really help people try to understand a bit about this lifestyle. I host carb sober cruises. I have 150 people joining me in early February onto a cruise to get together with green circle people and be able to stay out of the carb ditch and not give myself permission to, because I'm on vacation kind of thing. And next thing you know, people are inflamed and sick after a trip. So this is really, again, to surround yourselves with people, do meetups. Like I said, I'm passionate to gather people together. And Tony, you're officially in my green circle.
Hey, that's what I'm talking about. I'm glad. I was a little nervous, but I'm glad I made it.
You made it.
I made it. So thank you, Lisa, for sharing your incredible insights and expertise. I'll make sure to have a link to the resources you shared. It's clear that your personal journey, your knowledge have, the power to inspire real change. I think this episode will do that, especially for those who are struggling with vision issues and chronic diseases. So it's just nice to know that my eyes have a path to be better than they are today. So
Yeah. And I just want to throw in there one more thing. We were talking about how important it is to be gathered with people, surround yourself with people, and be part of a group. I host a membership group where you can talk with me multiple times a week,
nice.
and talk with others who are trying to achieve the same goal. And, there's a lot of groups out there. I just implore people that the biggest road to success is joining in together and being in a
Mhm.
group.
Yeah, coaching.
Yeah.
All the greats that we respect, Dr. Eric Westman, Adaptive Life groups, social media influencers like Bella for Steak and Butter Gang. Steak and Butter Gang is a group. Um, if you think about Dr. Tro, who's a metabolic doc, he has coaching through his resources to help people heal. Dr. Mariana Glant, she has coaching. So groups and coaching is foundational, and we don't have enough of them. You find a group that resonates with you, but I'll make sure Dr. Lisa's group is available to you, because without that support, when you struggle, it's nice to struggle with somebody that's going to lift you back up and help you and just provide perspective. Because once you understand sometimes that somebody's been there and done that just like you, and or there's a way to mitigate that struggle, it's nice to be able to hear from somebody with that experience. So thank you so much, Doc, for your time. My eyes feel brighter and better already just talking to you.
Yeah. Thank you. Thanks so much for having me on, Tony.
Absolutely. And for those who joined us today, protecting eye health is so much more than, wearing glasses or contact lenses. It's about understanding the root causes of disease. And your diet plays a monumental role in that process. So if you want to learn more from Dr. Lisa, I will make sure to have her resources in the video notes. And we'll do our best to continue to inspire you wherever you are so that you can achieve the metabolic health you deserve. Together, if we all work to protect our nest and walk towards our true north, which is metabolic health, I think we'll all be happy where we land. So thank you for taking the time to join us for this episode of the podcast. And until the next episode, continue to be safe, be well, and continue to protect your nest.